You feel it coming, don't you? That little tickle in your throat, maybe a sudden wave of aches and pains? Yeah, we've all been there. Today we're going to cut right through all that confusion and figure out what's really going on when you start to feel sick. Okay, let's get into it. That's the question that kicks it all off, isn't it? That very first sneeze or cough, and your mind immediately starts racing. Is this just a little 24-hour bug, or am I about to be knocked out for a whole week? Well, knowing the difference is actually the first and most important step to feeling better faster.
So first up, we need to understand what's actually happening inside your body. Pinpointing the cause is, without a doubt, the most crucial step on that road to recovery.
When you're feeling under the weather, it's almost always one of these three culprits. First, you've got your viral infections. You know, the common cold, the flu. They're definitely the most frequent visitors. Then there are bacterial infections, which just love to cause trouble in your throat, sinuses, or ears. And finally, you have allergies, which is really just your immune system kind of freaking out over something harmless like dust or pollen. The tricky thing is, at first, they can all look and feel surprisingly similar.
Okay, so how in the world do you tell these usual suspects apart? Let's put on our detective hats for a minute and break down the clues your body is sending you.
Right here is where things start to get a lot clearer. Think of a cold as something that just creeps up on you. It develops slowly over a day or two. The flu, on the other hand, it hits you like a ton of bricks. It's sudden, it's intense. You'll almost never get a real fever with a cold, but it's super common with the flu. And that flu fever often brings friends, like chills and some serious body aches. So the main takeaway here, if it came on fast and feels awful, you're probably dealing with the flu.
But hold on, what if you don't have a fever or any of those aches and pains? Well, if your main complaints are endless sneezing, itchy and watery eyes, or maybe even a skin rash, you could be looking at allergies. These are set off by things in your environment, and it's a completely different response from your body.
All right, so playing detective with your symptoms is a great start. But let's be real. Sometimes guessing just isn't going to cut it. There are some very clear red flags that mean it's time to stop wondering and actually call a professional. Now this right here, this is your non-negotiable checklist. You need to pay attention to these. If you have a high fever that just will not go away, if you're feeling short of breath, or if you have really bad pain in your ears or sinuses, don't wait. That is your body's signal to get help. The same goes for any symptoms that just aren't getting better after several days, or even worse, are actually getting more intense. Let's just focus on this number for a second. 39 degrees Celsius. A fever that gets this high, or really any fever that hangs around for more than 3 days, is a definite red flag. It's a very clear signal that your body is fighting something serious and could use some backup.
So, you've made the right decision and you've got an appointment. What happens now? Let's walk through what you can expect. It's actually a really clear path designed to get you back on your feet.
Your doctor's going to start with a thorough exam to really nail down what's going on. From there, they'll create a treatment plan that's tailored just for you. That might mean a specific prescription, some solid advice for managing your symptoms at home, like getting tons of rest and fluids, and probably a follow-up, just to make sure you're all the way back to 100%. See? It's a clear, step-by-step process.
This is one of the biggest questions people have when they're sick. It's so tempting to believe there's a magic pill for everything, right? But is that magic pill always an antibiotic?
The answer to that is a very clear, very simple no. Look, antibiotics are amazing, but they have one very specific job. They fight bacteria. They have absolutely zero effect on viruses, which, remember, are what cause colds and the flu. Taking them when you don't need to is not only useless, it actually contributes to the huge global problem of antibiotic resistance.
Okay, we've gone over how to deal with sickness when it shows up at your door. But what about the best strategy of all? Let's talk a little bit about prevention and how you can stay prepared. Especially for all you allergy sufferers out there, being proactive can make a massive difference. Figuring out what your triggers are and then taking steps to avoid them, like keeping the air in your home clean, can seriously cut down on flare-ups. And getting a doctor's advice early on can help you manage things even better.
And I really want to leave you with this one critical piece of safety advice, especially for parents and caregivers. Kids are not just tiny adults. Medications can affect them in very different ways. The bottom line is this. Always, and I mean always, talk to a doctor before you give a child any kind of medication for a fever or a cough.
So there you have it. You've got a clear guide to decoding what your body is trying to tell you. You now have the tools to tell the difference between a cold, the flu, and allergies. And you know exactly which red flags mean it's time to call in a professional. So the next time illness strikes, you're not going to be guessing. You're going to be prepared.